Hey, how's it going, everyone? This is FixerMed. Welcome to my high-yield biochemistry review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 13 of my multi-part video series covering the entire discipline of biochemistry in a high-yield but comprehensive manner. So without further ado, let's go ahead and get started. Today we'll be zoning in on multiple endocrine neoplasia syndromes. So there are 4 types of these you should know for these examinations. So the first one is known as multiple endocrine neoplasia type 1. This one is mainly characterized by tumors in various endocrine glands. These include pituitary tumors such as prolactinomas, which lead to hormonal dysregulation. Additionally, there may be parathyroid adenomas or diffuse hyperplasia, resulting in hyperparathyroidism and elevated calcium levels. Pancreatic tumors, specifically gastrinomas, can cause gastrinoma syndrome with associated peptic ulcers. Multiple endocrine neoplasia type 1 is associated with mutations in the MEN1 gene following an autosomal dominant inheritance pattern and is located on chromosome 11. A lot to take in there, but moving on. Next, we have multiple endocrine neoplasia type 2A. This condition is characterized by medullary thyroid carcinoma, which involves cancerous growth in the thyroid gland. Additionally, there is potential for pheochromocytomas, tumors of the adrenal glands that can lead to excess catecholamine production. Parathyroid involvement may manifest as adenomas or diffuse hyperplasia, causing hyperparathyroidism. The genetic basis for MEN2A is associated with mutations in the RET oncogene, following an autosomal dominant inheritance, and is located on chromosome 10. So 1 chromosome 11, 2A chromosome 10. I'll come up with some acronyms and stuff like that to try and help you recall these better. But right now, let's move on to multiple endocrine neoplasia type 2B. This condition involves medullary thyroid carcinoma, a cancerous growth in the thyroid gland. Additionally, there's a risk of pheochromocytomas as well here, tumors of the adrenal glands causing excess catecholamine production. Patients may exhibit a marfanoid body habitus characterized by tall and slender nature with long limbs. Mucosal neuromas, benign growths on mucous membranes, are also associated. Multiple endocrine neoplasia type 2B is linked to mutations in the RET oncogene following an autosomal dominant inheritance pattern and is located on chromosome 10, like type 2A. Next, we have the Carney Complex. This is usually presented in the context of an atrial myxoma occurring in a child. We'll be covering atrial myxomas more in the cardiology high-yield review series, so don't worry if you don't know what that is right now. Additional features found in Carney Complex include perioral melanosis characterized by hyperpigmentation around the lips and endocrine hypersecretion such as Cushing syndrome or hyperthyroidism. Carney Complex is associated with a PRKAR1 mutation, which can fuse with the RET gene through gene rearrangement. This condition follows an autosomal dominant inheritance pattern as well. Whew, a lot to take in there, but let's go ahead and test our knowledge out with some questions. So we have a 28-year-old male that presents with a tall stature, flat feet, mitral valve prolapse, and headaches. What is the most likely diagnosis here? It's a pretty easy one, so I'm just going to give you guys a few more seconds. The answer choice is literally the only thing we just covered, so. Alright, moving on now. If you guys need more time, feel free to pause the video. The patient's combination of features including tall stature, flat feet, mitral valve prolapse, and headaches along with the mention of atrial myxoma and endocrine issues is consistent with MEN2B, specifically the associated PRKAR1 mutation and gene rearrangement involving RET or key factors in MEN2B. Therefore, the correct answer is multiple endocrine neoplasia type 2B, MEN2B. Let's go ahead and cover why the other answer choices are incorrect. Marfan syndrome. While Marfan syndrome can present with tall stature and mitral valve prolapse, it does not typically involve flat feet and headaches. Ehlers-Danlos syndrome. Ehlers-Danlos syndrome may present with joint hypermobility and mitral valve prolapse, but it is not associated with tall stature and headaches. Turner syndrome. Turner syndrome is characterized by short stature, not tall stature. Neurofibromatosis type 1. Neurofibromatosis type 1 does not typically present with tall stature and flat feet and is not associated with mitral valve prolapse. Let's move on to the next question. Which of the following is the most likely diagnosis for a 3-year-old male presenting with atrial hyperpigmentation around the lips, and hyperthyroidism? Alright, I'm about to move on. If you need more time, please be sure to pause the video. I'm moving on now. The combination of atrial hyperpigmentation around the lips, perioral melanosis, and hyperthyroidism is a characteristic of Carney Complex. Additionally, Carney Complex is associated with endocrine overactivity. Therefore, the correct answer is B, Carney Complex. The incorrect choices can be explained as follows. Turner syndrome. Turner syndrome is unlikely as it typically does not present with atrial hyperpigmentation around the lips, or hyperthyroidism. C. Noonan syndrome. While Noonan syndrome may involve cardiac abnormalities, it does not commonly include atrial hyperpigmentation and hyperthyroidism are not typical features of Noonan syndrome. D. Neurofibromatosis type 1. Neurofibromatosis type 1 is associated with neurofibromas and café au lait spots, but is not typically linked to atrial or hyperthyroidism. McCune-Albright syndrome. McCune-Albright syndrome can involve endocrine abnormalities, but is not typically associated with atrial Hyperpigmentation around the lips is also not a characteristic feature. Moving on to the next question. So we have a 35-year-old woman who presents with hyperparathyroidism, pituitary adenoma causing acromegaly, and pancreatic tumor leading to Zollinger-Ellison syndrome. Genetic testing reveals a mutation in the MEN1 gene. What is the most likely diagnosis? I was very, very nice with the questions today, but that giveaway with what gene mutation is involved. So moving on now. If you need more time, pause the video. The patient's combination of hyperparathyroidism, pituitary adenoma causing acromegaly, and pancreatic tumor leading to Zollinger-Ellison syndrome is characteristic of MEN1. MEN1 is an autosomal dominant disorder caused by mutations in the MEN1 gene, which encodes the menin protein. It is associated with tumors in multiple endocrine glands. Therefore, the correct answer is A, multiple endocrine neoplasia type 1, MEN1. Incorrect answer choices can be explained as follows. Basically, they're not on the MEN1 gene, but I'll go ahead and read them out anyways. Multiple endocrine neoplasia type 2A, MEN2A, is characterized by medullary thyroid carcinoma, pheochromocytoma, and hyperparathyroidism. The presence of pancreatic tumor causing Zollinger-Ellison syndrome is not typical of MEN2A. Multiple endocrine neoplasia type 2B. MEN2B is characterized by medullary thyroid carcinoma, pheochromocytoma, and marfanoid habitus. The combination of hyperparathyroidism, pituitary adenoma causing acromegaly, and pancreatic tumor leading to Zollinger-Ellison syndrome is more indicative of MEN1. Von Hippel-Lindau syndrome. Von Hippel-Lindau syndrome involves the development of tumors in various organs, including the kidneys, adrenal glands, and pancreas. However, the specific combination of hyperparathyroidism, pituitary adenoma causing acromegaly, and pancreatic tumor causing Zollinger-Ellison syndrome is more indicative of MEN1. Carney Complex. Carney Complex can involve cardiac myxomas, skin pigmentation abnormalities, and endocrine overactivity. However, the specific combination of hyperparathyroidism, pituitary adenoma causing acromegaly, and pancreatic tumor leading to Zollinger-Ellison syndrome is more indicative of MEN1. Moving on to the next question. Which of the following is the most likely diagnosis for a 28-year-old male presenting with tall stature, flat feet, mitral valve prolapse, and headaches? Don't let it trick you. A little bit tougher than the other problems, but I think I've given you guys enough time. Moving on now. If you need more time, pause the video. The patient's combinations of features including tall stature, flat feet, mitral valve prolapse, and headaches, along with the mention of atrial myxoma and endocrine issues, is consistent with MEN2B. Specifically, the associated PRKAR1 mutation and gene rearrangement involving RET are key factors in MEN2B. Therefore, the correct answer is D, multiple endocrine neoplasia type 2B. Let's see why the other answer choices are incorrect. Marfan syndrome. Marfan syndrome may present with tall stature and features like flat feet, but typically does not involve mitral valve prolapse or the endocrine issues seen in MEN2B. Neurofibromatosis type 1. Neurofibromatosis type 1 is characterized by neurofibromas and café au lait spots, but is not associated with tall stature, flat feet, mitral valve prolapse, or headaches as seen in this patient. Multiple endocrine neoplasia type 1. MEN1 is associated with tumors in multiple endocrine glands, but does not typically manifest with the specific features described in this case. Ehlers-Danlos syndrome. While Ehlers-Danlos syndrome is associated with joint hypermobility and skin hyperelasticity, it does not typically present with the specific combination of features seen in this patient, including mitral valve prolapse and endocrine issues. So that will do it for this review session. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If you have any suggestions, please feel free to also leave those in the comment section below. If not, this is FixerMed signing off. Happy studying, everyone. Good day and goodbye.